When it comes to Medicare Part B, there are two distinct categories that your Medicare services need to fall under in order to be covered by Medicare. Today, I'm going to go over one of those categories, preventative services. And it's important to know if your service falls under this category and if you might have any type of co-insurance to pay for these services. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about Medicare Part B coverage, specifically for preventative services. So we're going to talk about what exactly constitutes a preventative service and how to make sure that your service is covered with as little cost to you as possible. If you find this video helpful, I'd appreciate it if you give it a thumbs up and subscribe and leave a comment down below. So like I said, Medicare Part B covers two distinct categories of services. The first is going to be medically necessary services, and I have a whole separate video where I talk about whether or not a service is medically necessary. And the second category that we're going to talk about today is preventative services or preventive services. So we want to make sure our service item, whatever it is, falls into one of these categories so it's covered by Medicare, because we don't want to pay for these services out of pocket if we don't have to. So when talking about a preventive service, what that's going to be is essentially healthcare to prevent illness. So something to stop you from getting sick or getting a condition, something to preemptively stop you from a continued illness. So a lot of times we think of preventive as things like shots, tests, screeners, things like that. They're going to help us make sure that we don't get sick or do our best we can to not get sick, because we want to kind of fight off these chronic medical conditions as early as possible to give ourselves the best fighting chance. So now the big question, what do I pay for preventative services? So with Medicare Part B, as long as it's a covered preventive service, you will pay nothing for most of these services as long as your doctor accepts Medicare assignment. So that's the only kind of catch with this. As long as these preventive services fall under Medicare's list of Part B preventive covered services, you're not going to have a co-insurance. So you won't have to pay that Part B annual deductible. You won't have a co-insurance, a co-payment. The only charge you may see is going to be an excess charge if you live in one of the states where excess charges are permitted and your doctor does not accept Medicare assignment. That being said, the majority of providers do, but it's something that could be easily verified beforehand. And then as long as you take assignment, you won't pay anything for these services. There is one small catch though. If you go in to see your doctor, healthcare provider, what have you, to get a preventive service done, but you also get something separate done, like a medically necessary service, kind of all in one visit, if you have a plan like a Plan N where you pay a $20 copayment for an office visit, since you got a preventive service, although you also got a medically necessary service, you're going to end up paying the copay for the whole visit. So if it's strictly for the preventive service, no copayment, no co-insurance. If it's kind of a multifaceted appointment where you get a flu shot, but you also do some separate blood work or something else like that, you may end up with that copayment. It's just something to remember. If it's a more complex appointment that goes beyond the preventive service, you may end up with a co-insurance. But if it's strictly a preventive service, no copayment as long as the provider accepts Medicare assignment. So that is great. Now we need to know, well, what falls under the category of preventive services? How do I know that my service is covered? Medicare.gov actually does a great job of listing the majority of preventive services that people get done. So on the website, you can see, I took a picture here, all the different things that can fall under preventive services that give you no co-insurance. So things like flu shots, pneumococcal shots, mammograms, diabetes screeners, things like screeners, testers, vaccinations, most of the time fall under preventive services. There are a couple vaccinations that actually don't fall under, such as the shingles vaccine. And again, I've got a full video where I go over that and I'll link it down below. But generally these things that again are preventing further illness are going to fall under this preventive category. So if we look here, we can get a pretty diverse list. And you'll also find this list in the Medicare and You guide. So it'll break down each one into the categories, give you a little blurb about what that service entails, and these will fall under the Medicare Part B preventive services. So if we look a little deeper, we'll pick one like a mammogram. And as you can see, most people need a mammogram about every 12 months. And if you look down at the bottom, it says If it's a preventive mammogram, so a screener, you pay no cost on the original Medicare, so no co-insurance. It's covered completely by Part B. However, if it has to go further, if it becomes diagnostic, it is no longer preventive. It is now more complex, and you will be responsible for that 20% under Medicare Part B because we've now switched into the category of medically necessary services. So again, preventive is kind of screeners, testers, but anything more diagnostic is no longer going to be a preventive service. That's something to talk about with your provider. They will let you know up front if we're kind of switching categories, if we're going a little bit more extensive. We've now left the preventive service category and gone into medically necessary. So when it comes to preventive services, there's two things you want to really remember. You're going to have no co-insurance under Medicare Part B as long as it falls under preventive services, as long as your doctor accepts Medicare assignments. That's really the big factor. If your doctor accepts Medicare assignment and you have no excess charge, there'll be no cost to you for these Part B preventive services. I hope you found the information in this video helpful. If you have any questions, you can give me a call. My number is 833-65-JAMIE. You can visit my website, medicarebyjamie.com. So I work with people, helping them find the best Medicare supplement plans. It's going to help you find out what's covered by Medicare, and if it's not, get you a plan that's going to help you cover that back end so you're not responsible with a ton of out-of-pocket on your part. You can always go to my website, medicarebyjamie.com, request a free Medicare supplement quote. There's no cost to you to use my services, and I'd be more than happy to explain all of this to you. And if you found this video helpful, I'd appreciate it if you give it a thumbs up and subscribe and leave a comment down below. Thanks for watching, and if you stay tuned, I'm going to give you a tour of my website and show you exactly how to request that free Medicare supplement quote. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful, and thank you for watching.